question. So, but yeah, it's very real, unfortunately. I'm doing consultations right now, but I'm booked up until the end of November right now. So, but today, I was working with someone one on one, and I asked them if I could actually talk about this. And I talk a little bit about this in my book, where I mentioned my father. Like, I had moved away to Japan, and I was working there in Japan at a hospital, and also doing some research on the people who lived there in the northern part of the island, who lived to 100, no disease, eat primarily a plant-based lifestyle, and they died with no disease in their sleep. Okay, and while I was there for almost 4 years, my dad's health started to decline, and you know how men are. They don't really talk about when their health is bad or if it's good. Like, they keep it on the hush. And so I come back to America and find out my dad had a stroke. This is maybe 6 years ago. My dad had a stroke. I flew back to America. And before I left, like, my dad was doing great. Like, I got my dad a juicer. I got my dad a blender for smoothies. So he was making smoothies. He was making green juices, taking them into work, sharing them with people. And I was just excited, to see my dad go through the process that I went to. Because when I first went plant-based, like, I used to eat horrible. And when I went plant-based and I got all that energy, all that libido, my waistline, my neckline back, it really excited me. And so to see that in my dad before I left, like when I moved to Japan, I thought my dad was in good hands. But here I am, I come back and my father has had a stroke, and it scared the shit out of me, because that was the first time I saw my dad look frail. Like, he was always this strong man to me. And so, I'm looking at all the medications he had been on prior to the stroke. And one of the medications he was on was a statin drug, okay? Now, statin drugs are made to lower the cholesterol in the body, okay? Typically, you go in, your doctor sees you have a cholesterol above 200 or 150 if they're looking at your LDL, and they say you have high cholesterol. Now, in my opinion, what I've noticed is that those numbers are extremely too low. We need cholesterol in our body. And that's sort of like the facts that nobody knows about, because we've demonized cholesterol and made cholesterol this bad thing that is supposed to cause not only heart disease, but it causes strokes, causes vascular issues, along with a lot of other issues, health issues it can cause. Now, me and my research, what I was able to discover, and this is research that you can go on and discover for yourself now, is that the statin drugs are the highest selling drugs in the world. The number one seller in terms of prescriptions is Lipitor, which is a statin drug. Okay, the generic is atorvastatin. Okay, now my dad was on one of those statin drugs, and some of the typical side effects that when I worked at the hospital, I had to tell patients about these, is that statins could cause a near fatal condition called rhabdomyolysis, where the muscles would essentially begin to spasm so much that it could actually kill you. Okay, statins actually increase the risk for diabetes. Okay, but what isn't talked about with statins were some of the other symptoms that I had noticed when I was looking at my dad's medical chart. Now, my dad, again, he never complained to me about what was going on. He's from that old school generation, so he never really talked about it. But my dad started to feel a lot of knee pain, so he stopped exercising, a lot of muscle pain, okay? Also, my dad started to have memory issues, okay? Statins will cause you to have memory issues as well, okay? Not only will statin drugs like Lipitor, atorvastatin, and other drugs like that will cause you to have memory issues, and also cause you to have issues with muscle pain, okay, which they attributed to older age. Just think about it. My dad was 60, so like around 60, like, okay, he's getting elderly, so losing his memory, that sounds like an elderly person. Knee joint pain, that sounds like an elderly person. Starting to develop diabetes, where he's black, that makes sense. This is how people typically run a patient down when they go into the hospital, okay? Now, when I saw my dad, I'm seeing the man. I get to see, I know what my dad eats, I know his lifestyle, and I know that typically my dad didn't have knee pains, and my dad had a memory like an elephant. I mean, my dad would remember things when I was 2. I mean, I'm not joking. Like, I almost drowned when I was like 4. My dad took me out with his homies. We went out to this like, huge river. And while they were jumping in, I decided to jump in too. Now, mind you, I'm like 4. I jump in, I'm under the water. My dad comes in to save me. Now, I remember that, and I was 4 years old. My dad remembers everything about that. And that's what I knew about my dad. So like when I moved away, I'm like, how can my dad's memory get this bad this quick? It doesn't make sense. And so as I'm looking through his medication regimen, I see the statin drug there. Okay? I see the statin drug has caused him to have memory issues. I see the statin drug has also caused him to have some muscle pain, which he complained at his knee and his legs. Okay, I see he's now developed diabetes. It could also cause that. I also see that he's had a stroke. Okay, now this is what people don't know, because typically doctors will prescribe a patient a statin drug when they have high cholesterol to prevent a cardiovascular event. And what I mean by that is this: typically what they say in traditional medicine, even what I was taught when I was in school, was when your cholesterol is high, guess what? It can increase the risk for a heart attack or a stroke, okay? Now, what I learned outside of school and my own personal training and my own research was that cholesterol is heavily needed, okay? This is how important cholesterol is. Every cell in our body has a layer around the outside of it called a lipid bilayer. That lipid bilayer is cholesterol, okay? All of our sex hormones, testosterone, estrogen, are made from cholesterol, okay? 75% of our nervous system, our brain, is made from cholesterol, okay? So you have to understand, like, our body needs cholesterol. Our body needs healthy fat. It's so important that when you're asleep, if you don't have enough cholesterol, meaning you haven't consumed enough in your diet, your liver will make cholesterol while you sleep. And that's what the statin drugs do. The statin drugs target the liver and stop the liver from making additional cholesterol. Now, here's what the issue is. When you take a statin drug, it will actually cause you to possibly have a condition known as hepatitis. And hepatitis, hep is for liver, titus or itis is for inflammation. So inflammation of the liver. So statin drugs could possibly cause you to have hepatitis or inflammation of the liver. Why? Because of how the drug is actually made and the targets that it has on the liver specifically. Okay? So it's so much so that every 6 months, if you're on a statin drug, you're supposed to go back and get your liver enzymes checked, because they need to see if you're having inflammation from the drugs. Okay, so that's the really important thing to understand. So now, as we move forward, as I go through my research, what I discovered was the initial clinical data that came out about statin drugs was this. Initially, they said that they reduced the risk of heart attacks, strokes, and things of that nature by lowering cholesterol. But what was later discovered was this. The study that they used, the scientists, when they used it, they actually fudged the studies. All right? And how they fudged the studies was this. They used what's called relative results versus absolute results. And I'm going to break that down real easy for you, okay, so that you understand it. All right, and this is how easy they can change science so that it makes the drug look like it's actually working. When it's not working at all, it's doing the total opposite. Okay, so relative study would be this. During 1,000 years ago, when people were looking up at the sun to tell the time of the day, they were able to do that because they could see the position of the sun and tell you what time of the day it was. Okay, now, if a scientist back in the day were to do that, they could say, if I can tell you the position of the sun and I can see it rises in the east, okay, and then it sets in the west at nighttime, that then tells me that the sun is moving around the earth. This is why people thought the sun was moving around the earth, okay? Now that's a relative study. Now, that information isn't bad information, meaning I can detect the sun in the east in the morning. I could detect the sun in the west in the evening, okay? I could see the position that it's in on both times. And this will logically make me say, okay, the sun is moving around the earth, okay? So it sounds logical, but this is the fallacy in that type of relative study. It's not an absolute study. The absolute would be, okay, now that I've done that on Earth, let me do that outside of Earth, okay? Let's say I go to the sun now, and now I'm looking at the Earth from the sun. And now I'm noticing from the sun, the Earth is actually moving around the sun, not around Earth, okay? That's an absolute study when you look at it from two perspectives. I'm looking at it both from being on Earth, now I'm looking at it from not being on Earth, okay? And when you look at it from the absolute perspective, where you look at it both on Earth and then off Earth, now you see that, oh no, the sun doesn't revolve around Earth. Earth actually revolves around the sun. What happens is, as the Earth is revolving around the sun, it's revolving at a 23-degree angle, and it's actually rotating as it goes around the sun. And because it's rotating, that's what makes it look like the sun is actually rising in the east and setting in the west. So it's actually the sun moving, it's actually the Earth itself rotating that's causing the sun to look like, it's actually revolving around the Earth. So it's really important to understand that when you do science, you have to do science in such a way where it's an absolute, not just relative. Because relative, what I think about Black Lives Matter isn't what somebody who's not black may not think about Black Lives Matter. Is relative because I just happen to be black. You understand? So you have to look at it from an absolute perspective. That's always the most important thing, especially when it comes to science. Now, when it came to the statin drugs, they used the relative perspective, only looking at it from the perspective of being on Earth. Okay? They chose not to use the absolute because when they used the absolute, the study actually showed that it didn't help with any heart risk factors at all, okay? Actually, it increased the risk for heart attacks and strokes, okay? And that's what you saw as a clinician. All of a sudden, we were using these drugs as if they were candy, and then all of a sudden, you start to see us pull back because now you have these pharmaceutical sales rep coming into the hospital telling us like, hey, you can't use, this statin drug with this type of drug, and then you can't use over 20 milligrams. Now you gotta go start with 10 and then escalate up to 5. Don't go to 40. Now they're pulling back on the drug we thought was a miracle, okay? And so then when I started to look at my dad's situation, it made plenty of sense. It made plenty of sense why he didn't have the memory that he used to have. And again, I talk about this in my book. It made sense that he was having the leg pain. It made sense that he was starting to get diabetes. It made sense that he had a stroke. You understand? Now, let me explain what cholesterol is for in the body, and then I'm gonna help you understand why all of these issues occurred, okay? Cholesterol is essentially the repair in the body. It is there, it's like a Band-Aid, okay? The whole function of cholesterol, I told you before, 75% of the nervous system, the brain and the spinal cord is cholesterol, is fat, okay? Our hormones, testosterone, estrogen, vitamin D, these are made from fat, okay? So it's important to understand every cell in our body has a lipid bilayer on the outside of it. You can look it up, fat. So we need fat. It is absolutely necessary. Now, when you see in studies and you read in textbooks that it's cholesterol clogging up the inner layer of the vessels inside of the heart or inside of the brain, what's important to understand about that is the cholesterol is coming there to put out a fire, okay? All right, so the fire is called inflammation. That's why it's called inflammation, okay? Inflammation is literally like a fire, okay? When we eat foods that are inflammatory, and essentially the American diet is inflammatory foods, is essentially like creating a fire inside of our blood vessels, okay? And it's really important to understand that, because even when you look at things like pneumonia, okay, you look at the flu, you look at corona, it's not corona that actually kills people. It is the inflammation inside of the lungs that ends up killing people, okay? Them not being able to breathe, okay? Same thing, if you get the flu, you don't die from the flu, you die from the inflammation inside of the lungs, okay? Same thing, when you have a heart attack, what is happening is there's inflammation inside of the blood vessels, okay? The cholesterol comes in like a patch to put out the flame, okay? Now, if you have inflammation in the same area, there's more cholesterol on top of it, more cholesterol on top of it, more cholesterol on top of it. Yes, it's going to make the lumen or the inside of the blood vessel get smaller and smaller and smaller. But the cholesterol is only coming to put out the fire, okay? And what's important to understand about that is look at it from this perspective. If we were to do another study and look at houses when they're on fire, okay? And let's say, for instance, I grew up on an island, in a hut, and then I come to America and I've never seen a fire truck, a city, or any of that kind of stuff. But every time I see a house on fire, I see a fire truck there and firemen. Okay, in my mind, I could say that a fire is caused by firemen in a fire truck. Okay, because every time I see a fire, I see a fireman in a fire truck, okay? But again, that will be looking at it from a relative point. That wouldn't be looking at it from the absolute. So it's the same thing with cholesterol. Cholesterol, we need cholesterol. Cholesterol is coming into the blood vessels because it's putting out the fire, okay? So you can't blame the cholesterol. What you have to blame is the inflammation or the source of inflammation. And the source of inflammation is always, in many cases, the diet when it comes to this, okay? And the greatest way I can help you understand that is this. If food is processed, okay? And by process, I mean it's in a box, bag, can, has an ingredient label, and you look at that ingredient label and there's so much stuff in there or chemistry that you can't pronounce the name. It is that chemistry, it is that processing that causes inflammation in our vessels, okay? And that's very hard for people to accept, but let me help you understand why it's easy to understand. Where people have the most strokes, the most heart attacks, is in an area of America called the Bible Belt, okay? So that's essentially like the southeast area of America. That's North Carolina, that's Mississippi, that's Georgia, that's Alabama, okay? And the reason why people have the most heart attacks, the most diabetes, the most strokes in these areas is because in that Bible Belt of America, Mississippi, Louisiana, Georgia, North Carolina, Virginia, these areas, people in these areas love fried food, Okay? Fried food causes inflammation. Fried food causes free radicals. Free radicals is what causes inflammation inside of the body. That's so important to understand. Okay? So when you're eating fried food from fried oils, okay? I don't care if it's plants. Okay? When you take something like, I'm just like, sometimes let's say you fry up some vegetables, okay? You put it in oil, you fry it up, okay? You have taken a perfectly good food and turned it into a junk food, okay? And I know that's harsh to say, and I'm not saying you have to be perfect, but it's really important to understand that when you take something in its raw form, vegetables, and you put it in a pan and you fry it up with oil, you have turned that perfectly good vegetable or food into a junk food. Okay, and let me explain why. Oils, when they increase the temperature of them, they turn into something else. Okay, it's the same way if I took your hand and put it in a pot of oil that was hot, it will turn into something else. Okay, it will not be nourishing anymore. It will change the molecular structure inside of your hand. Okay, it does the same thing to food. When you see food in its rawest form, that food in its rawest form has digestive enzymes, it has antioxidants, it has phytochemicals, it has vitamins, it has trace elements, it has minerals. Okay? When you add that amount of heat to it, it changes the molecular structure of all of that. All of that goodness that was in there, that when you read the label and you say, okay, this is kale, this is arugula, okay? When you add heat to it, it changes the entire molecular structure of that food, okay? It gets rid of those cofactors, it gets rid of enzymes because they are temperature dependent, meaning temperature will change the structure of that. So you no longer get the full benefits of it. So people were asking me earlier, like, what do you typically eat in a day? This is why I start my day off with things that are raw. That's why I said eating fruit in the morning. This is why I said green smoothie, green juice. That's why I start my day off like that, because I want to get food in its purest forms. I want all the enzymes. I want all the vitamins. I want all the minerals. I want all the phytochemicals that are responsible for fighting cancer. You see what I'm saying? I want all the antioxidants that build my immune system. I want it all. But when you start to cook that food, you kill all of that away. Okay? It's really important to understand that. Now, I'm not saying that you have to be 100% cooked, although that is ideal. But what I'm saying is you have to have balance in your diet. And going back to what I originally started with, it's important to understand that cholesterol in and of itself isn't the cause of what people are trying to prevent. As I said before, the number one selling drug today is Lipitor. It's the number one selling drug of all time, a statin, that is responsible for lowering your cholesterol. Okay? So when your cholesterol gets low, you have to remember what I said. We need cholesterol for hormones, our sex hormones, even vitamin D. Vitamin D is not a vitamin, it's a hormone, okay? We need cholesterol for our testosterone. So when you don't get enough cholesterol, good fats in your diet, guess what? Men are gonna have low testosterone. That means low libido. That means prostate cancer, okay? If you don't have enough healthy cholesterol, not oil. When you don't have enough healthy cholesterol, you're not gonna have enough vitamin D, which is critical to your immune system. Okay, when you don't have enough healthy cholesterol, you're also not gonna have enough fat for your brain. This is why so many people are getting dementia at an early age. And I also tell people this, ADD and ADHD, attention deficit disorder, is a warning sign for future dementia. Cholesterol, healthy fat is so important player in the role of having a healthy brain. Okay? So you got to get the best cholesterol. Okay? So you got to eat healthy fats. It's pivotal. Every cell in our body. You can look this up. Look up the human cell, and on the outside there's a lipid bilayer. It's called lipid bilayer. Like Lipitor, lipid bilayer. Okay? Every cell in our body needs healthy cholesterol. Okay? If a woman doesn't get healthy cholesterol, okay, it's important to understand that she may have hot flashes. Okay? Especially a woman who's in her 50s. Instead of having hot flashes for a couple of months, she may have hot flashes for 5, 6 years because she's on a statin. And that statin is lowering her cholesterol even lower and lower and lower and lower. I've worked with people all the time. They're trying to figure out, well, why is my hot flashes lasting this long? It should be over by now. And discovered they were on a statin. We removed the statin, and in a couple of months, the hot flashes went away. Okay? So you have to understand cholesterol is actually a friend, not an enemy, especially when you're eating the right type of healthy fats. Okay? So I hope this has been helpful. This is the type of information that I love sharing inside of my tribe members. I see I got a couple of tribe members on here today. So if you're interested in becoming one of my tribe members, you can go to my bio, click on the link, and find out more about my tribe healing community. But you have to understand that most of what we've been taught about health is a fallacy. There's no truth to it. Like, we have a misunderstanding about it because it's not holistic. And by holistic, what I mean is there's not a full picture involved. When they look at health, they look at high blood pressure and they think blood pressure in the vessels. They don't think kidney, liver, heart, blood. You understand? When they look at an infection, they don't think good bacteria in the gut where 80% of the immunity is made. They're not looking at everything from a holistic perspective. They're looking at it from a relative perspective instead of the absolute. So I hope this information has been helpful. Just wanted to come in here, drop a few gems. If you enjoy the information, make sure you like the post, stay subscribed to me on YouTube, and the more you guys like, comment, share, I'll keep coming with more information. So enjoy the rest of your evening, and until the next time, peace and blessings.